name is Rachelle Rocha and I'm a pharmacist. Here today I'm practicing in my neighborhood pharmacy and I want to talk to you about how to transfer a prescription. What does that mean, transferring a prescription? So let's say I'm on vacation and I forgot to pack all my medication and I've gone to some other part of Canada, from anywhere in Canada to some other place in Canada. I don't have any pills with me. This could be a problem. So you have a few choices at this point. The first choice you have is to transfer your prescription from your home pharmacy to the new pharmacy where you're at. And that's very easy to do. First of all, find a new pharmacy where you want to get your prescription filled. The second thing you need to do is inform them of all of the information. So what your name is and your birth date. For sure, they need these two pieces of information because when they call your old pharmacy, after you give them the phone number, thank God we have the internet because we can always look up phone numbers. But for sure, if you have the phone number of your old pharmacy, your name and your birth date, and also if you happen to have your drug plan information, that's also a good thing to give to the new pharmacy. So you're at the new pharmacy, you've given them permission and authorization to contact your old pharmacy to get the prescription transferred. And every pharmacist anywhere is obliged by law to transfer the prescription anywhere the patient wants, because who's in charge of you and your healthcare? You're in charge of you and your healthcare. So you can decide where and when you're going to get your prescription filled. So here you are, you're in your vacation place. The pharmacist is going to relieve the stress of not having your pills with you. They're going to call the pharmacy, they're going to provide your birth date and your name, and then that information will be faxed over, or it can be given over the phone. The details can be given over the phone. And then what's required is a little bit of paperwork happening between the two pharmacies, and then you can get your prescription filled at your vacation place. Now, if you just want to change your pharmacy because you've moved neighborhoods in the village, and that's going to be a permanent change, not a temporary change. So when you're there for your vacation supply, all of your repeats will go. You will fill your what you need to get through your vacation, and then all of those files will be transferred back to your home pharmacy. Now let's say you've moved and you're in a new neighborhood in the same town. So the same thing can happen as you can go to your new pharmacy, provide that same information, your name and your birth date, what medications you're on, and the pharmacy will transfer everything sort of permanently. Now the second thing that you should do is also inform your doctor, because if your doctor knows that you've changed pharmacies, then all of your new prescriptions will go to the new pharmacy instead of the old one. So that's really important. Even if you transfer pharmacies and the pharmacist has done all of this work, you need to let your family doctor know. You don't want to have an interaction with the previous pharmacy, you can just tell your doctor that you've changed pharmacies and start bringing your new prescriptions over to the new pharmacy. One of the things that's really important is to keep your complete medication profile intact. So it's a good idea, and what I do this when I'm transferring prescriptions from another pharmacy is I ask for the entire profile, and that includes the medications that you no longer have repeats on. Because for me, in my process of helping make sure that the drugs are right for you, I want to know kind of all of your recent medical history and all the drugs you've been on and maybe tried and they didn't work. So I like to get everything transferred, even the inactive stuff and the stuff that doesn't have any repeats left, just so that I can get to know you better. It's kind of a bit of a shortcut way for me to get to know a little bit about you and your overall medical conditions, the state of health based on your prescription record. The pharmacist that holds your complete patient record is a valuable resource to have, and you should keep that pharmacy's phone number with you, because if you end up at the hospital or an emerge, frequently they will want a list of the medications that you take. So that is a very good thing that your pharmacy can provide for you. It's either a wallet card, which is a small card that has all of your prescriptions on it, or a big page that is your complete medication patient profile. So that's what you need to know about transferring your prescription and keeping your medication profile all intact and all of your medication information at one place.